and Sahil is, I think, from the Entrod team.
Uh, we are live,
Bhalla,
please.
Bhalla.
We are live, please.
Good evening, ladies and gentlemen. It gives me great pleasure to welcome all of you to this installation ceremony of the New Delhi chapter. Please allow me to welcome Dr. Amulya Sahu, the founder chairman of the International Society for Manual Small Incision Cataract Surgery. We also have with us Dr. Ravi Trehan, Dr. Lalit Varma, and the others will be joining us shortly. To briefly give you an overview of this society, it started off. It is a society with a pan-India footprint and chapters in almost 3 score countries across the world. It has played yeoman service in popularizing manual small incision cataract surgery. And very recently, we did an analysis where we found that almost 56% of the authors in manual small incision cataract surgery were from India, followed by the United States and China. So, with no further ado, I will hand you over to the MCs for the evening. We have Dr. Richa Gupta and Dr. Neetu Gagneja to lead us through the evening. Dr. Richa and Dr. Neetu, please.
Thank you, sir.
Thank you, Dr. Bali. A very good evening, everyone. I'm Dr. Richa Gupta, and I welcome you to this historic event, the installation ceremony of the Delhi chapter of International Society of Manual SICS. This is probably the only global ophthalmic organization which was founded in India, and our visionary, Dr. Amulyanath Sahu, laid its bricks in Mumbai in 2005, and since then, this has dedicated itself in promoting excellence, accessibility, and high quality training in manual SICS. So today we have with us the esteemed office bearers of the team, and let us listen to their pearls of wisdom. First and foremost, I would like to invite our beloved founder chairman, Dr. Amulya. I invite you, sir, to officially inaugurate the ceremony and deliver your welcome address. Dr. Amulya, please.
Thank you very much. It gives me immense pleasure to install this Delhi chapter of ISMSICS. Dr. Bali is a dynamic person and a very talented person. Anu is a very enthusiastic colleague of ours, and all of you are very talented people. And we are looking forward to Delhi chapter doing wonderfully well in taking the SICS training to the grassroots level. All of you are professors, associated professors, and other things. So it will be you will render a human service when you train young people in SICS and make them complete cataract surgeon. Thank you so much.
Thank you, sir. So we also look forward to this evening today. Next, we have Dr. Boramani. Dr. Bali?
Dr. Boramani will not be joining. He's busy somewhere else. So maybe we can call upon our president, Dr. Lalit Varma is the president of the ISMSICS Society. And Dr. Neetu, can we share screen, please?
Yes, I'll do that.
Yeah, I'll do that. These are our office bearers.
Yeah, could we go back to the previous slide? So we've already met Dr. Sahu, who is the founder chairman of ISMSICS. We have this team which consists of Dr. Sahu, Dr. Boramani, Dr. Gogate, Dr. Lalit Varma, who is the president, Dr. Satanshu Mathur, the chief national coordinator. Dr. Subudhi will be shortly joining us. The national coordinator is Dr. Ravi Trehan, and Dr. Neeta Dodwad is the conference coordinator. So I will.
You see, I should, congratulate this momentous occasion today primarily because the team which is, taking over Delhi chapter has enormous potential. You see, if they wish to contribute to ISKMIS, I think with Bali and Rajesh Sinha and, Anu and so many other people, they have loads of experience, loads of experience. Like Bali was saying, I just heard when I was traveling in the car that, India is the leader of ISKMIS. And I had told, Dr. Sahu long time back that you have to show to the world, you have to show that there should be no other, stone unturned at all. That everybody, I am so happy the way Dr. Sahu and Boramani and everybody has, I remember the first chapter, Egypt, and then Ransco, and so many international chapters where I was physically present there, and so happy feeling that India is leading the way. And the way I think this is going on, this time is, very near that the entire world will realize what is the magic of SICS. With hardly any, machinery, hardly any, high-end, machines which people keep boasting. And 2 days back, we had this occasion when most of us were there about this Nigerian, chapter, along with, their book being launched, research book, with Dr. Naik and, other people being there. So it is such a happy occasion, and I wish it sees the light of the day, the way which Amulya Sahu has sought, has envisioned, the way I think all of us feel that why India? Primarily because you see there's so many people, whether FACO people believe it or not. And I had in later been said that we should, and on that day calculate SIAs, being done by FACO and as well as, surgically induced estimate, and compare head on with, with SICS. And Amulya Sahu had presented those, sub 2 millimeter incident technique also. So there's immense potential in this society. And the way I think, if guided nicely, the world will be at your footstep. That is what I have vision for ISKMIS. So congratulations to Bali, congratulations to Annu, and all Rajesh Sinha and so many other people. There are 7 people in the executive also who have, immense potential to take it forward and do regular events. You see, this by doing regular events, this has to percolate even the minds of the established FACO people that ISKMIS is small manual small is second to none, and it should be the torch bearer. So thank you, Amulya Sahu, and thank you everybody for leading the society and leading the world also.
Thank you. Thank you.
Thank you, sir. To put things in perspective, let me tell you the backstory to it. Dr. Lalit Verma was the president of the AIOS when the magic of SICS sessions started there. He has been a very firm proponent of this society, and he is also a leading light. He's the director of the VR services at CFS after having served the All India Institute for 21 years and AIUS for what, 30 years, sir? 33 years.
Forget that. 28 years.
Thank you so much, sir. It's always a pleasure to have you. And now we can call upon our next speaker, Dr. Richa, please.
So, Dr. Satanshu is not there. He's our Chief National Coordinator. He's not
So
joined,
when
sir,
he
right?
joins, so
Yeah,
we'll call him when
I
he
think,
joins.
we can, yes. And Dr. Subudhi is our secretary. We have Dr. Ravi here with us.
So
Dr.
Dr.
Ravi is our national coordinator, and he's been the past chairman of Rajasthan chapter ISMSICS. He's interested in teaching and training residents in SICS. Sir, are you there?
Yeah,
Yes.
he is there.
Also
Can we change the slide also?
Yeah.
So Dr. Trehan he has a lot of interests in SICS and around SICS. Is your screen frozen, Dr. Richa.
Yes. It's not moving.
It's
Dr.
not moving. So I think you could do an escape. You can stop sharing and maybe
Neetu, yeah, can you
Dr.
do that?
Neetu can do that.
I have sent a request, so kindly do it.
Yeah, so you'll have to. Is the audio
I
visual
have to
there?
stop share 1 minute. I'll just stop sharing the screen.
Yeah. Dr. Neetu, I think you'll have to share screen from your end.
Once again.
We can go full screen mode.
Just 1 minute.
Dr. Trehan, number 10, yeah, from present slide.
Good evening, friends. Am I audible?
Yes, sir.
Absolutely,
Loud
sir.
and clear.
Thanks for inviting me on inauguration ceremony of Delhi chapter. Personally, I know each and every, almost all of you, especially Dr. Lalit Verma. I remember because of magic of SICS, we got the opportunity to participate in AIUS proceedings. Otherwise, previously, this segment is almost neglected and very few speakers are coming on the scenario. But with magic of SICS, long sessions of 120, 180 minutes, and then two magic of SICS first as well as second, basics as well as advanced. And I see here potential members of Delhi Society are coming and joining as an executives. Dr. Bali, with his team, I hope they will do lot of the research in SICS, CICS, smart SICS, and all kind of small incision or smart incision cataract surgeries. Best wishes to all. Congratulations on getting this post. Thank you.
Thank you so much, sir. You're always an inspiration. And I take this occasion to welcome Professor Namrata Sharma, who's joining us from the Singapore National Eye Center. Welcome, ma'am. Good evening. It's nice to see you, ma'am.
Thank you so much. Thank you.
Dr. Richa, you could probably introduce the lady.
Yeah, so we are fortunate to have the two stalwarts of Indian ophthalmology, Dr. Radhika Tandon and Dr. Namrata Sharma, who will be guiding us as patrons. So Dr. Namrata Sharma is holds key positions, including the Chairman Scientific Committee AIOS and Treasurer APAO. She was the first Indian to be inducted as Director at Large International Member in the Cornea Society of USA. She's been listed amongst the top 2% scientists worldwide by Stanford. She has over 660 publications and book chapters to her credit. Ma'am, can we have few words of wisdom from you, please?
So thank you so much for this opportunity. I think it is a great opportunity to work for the ISMICS, and I really had a great time organizing the ISMICS conference in November last year. And I'm sure there are still uncharted territories, and happy to be part of this Delhi ISMICS chapter. And I'm sure, like Dr. Trehan sir also said, that we will do our best. Thank you again for having me.
Thank you so much,
Thank you,
ma'am.
ma'am.
I
Yes, Dr. Bhaji.
I was almost afraid that it would be midnight at Singapore right now. So thank you so much, ma'am. It was nice having you. And do we have we don't seem to be having Dr. Satanshu has not joined.
Yes, I'm
Do
sure,
we
sir.
see Dr. Satanshu here?
No, sir.
You carry on the installation.
Right, sir. Thank you so much, sir. So
I now invite my co-moderator, Dr. Neetu, who will be taking forward the ceremony from here.
So thank you. Good evening. It's my privilege to take the proceedings forward and introduce some of distinguished colleagues in ISMSICS Delhi chapter. To begin with, Professor Dr. Rajesh Sinha, so who's the chairman, and he's a professor at RP Center AIMS, and key roles is the past president, Delhi Ophthalmological Society, and former treasurer of AOS. We welcome you, sir. Kindly share a few words with us.
I think
So
we've
don't
lost
we
him.
have?
He's not there yet.
We've lost him. We've lost him. So I think.
So going to the next, we have our president, Professor Dr. Bali, who's a chairman of International Research Committee, ISMSICS, associate editor of Global Journal of Cataract Surgery and Research in Ophthalmology, member Scientific Committee AOS, DOS representative to AOS. We welcome you, sir. Kindly share a few words with us.
Respected seniors, distinguished teachers, my esteemed colleagues, dear friends, members of this ISMSICS family, a warm good evening to everybody. Today, I accept this responsibility with great humility and gratitude. I have been entrusted with a difficult task because I have the privilege of taking over from one of the most popular ophthalmologists in our country, Professor Rajesh Sinha. He always sets very high benchmarks, and having to follow Dhoni as a captain of any team is always going to be a very tough ask. But then we are the New Delhi chapter, the capital of a nation, must aspire to lead by example. We are at an inflection point in our education policy, and we hope to be the catalysts of all the good new things that come. Well, personally, this has been an emotional moment for me. I come from Solan, which is a small town in Himachal Pradesh. Delhi welcomed me. It gave me opportunities. It gave me wonderful colleagues, lifelong friendships, and mentors who have shaped my career. I remain deeply grateful to this city. Delhi is the land of opportunities, but even more importantly, it is the land where dreams come true. During my tenure, I hope this chapter will help many young ophthalmologists to realize their own dreams. I have been fortunate to learn from outstanding teachers, including Dr. Jagatram, Dr. Sahu, Dr. Nayak, Dr. Lalit Varma, Dr. Pandav, Dr. Azad. The list is long. Their guidance has been invaluable, and I carry their lessons with me every day. We are equally privileged to have among our patrons Professor Radhika Tandon and Professor Namrata Sharma, two leaders who have consistently transformed vision into action. We shall look forward to you for your guidance as we build this chapter together. Friends, every organization needs a vision. Our vision stands firmly upon three pillars. The first pillar is training. We will organize wet labs, simulation-based learning, surgical workshops, skill transfer programs, so that every surgeon who wishes to master manual small incision cataract surgery will find an opportunity to learn it here and will find a mentor within this chapter. That is our promise. The second pillar happens to be research. They say experience changes individual practice, but it is evidence which changes the world. For far too long, others have defined the narrative of cataract surgery. It is now time that we define our own. We cultivate the research mindset, and we are going to do this through workshops on research methods, on scientific writing, on biostatistics, artificial intelligence, publication ethics. We will build collaborative networks and opportunities for multicentric studies so that every observation contributes to knowledge. You see, the future of manual small incision cataract surgery is not going to be decided only by the number of surgeries we perform. but also by the quality of evidence that we produce. Our dream is simple, yet it is ambitious. Every surgery should become a data point. Every surgeon should become a researcher. Every hospital should become a laboratory of scientific observation. Our third pillar is youth. Young ophthalmologists are the future of the specialty. We will create opportunities for them to present, to publish, innovate, lead, and grow. Our academic calendar will reflect this vision with webinars, with research method programs, journal clubs, AI, innovation sessions, manuscript writing workshops, research meetings, and inspiring face-to-face gatherings. Many have remarked that this is a young team, and I agree. But may I add, this is a young team of lions. You see, youth brings energy, experience brings wisdom. Together, they become an unstoppable force. Now the responsibility is mine to ensure that we set our sights high enough to inspire, yet realistic enough to achieve through discipline, through teamwork, and perseverance. India gave cataract surgery to the world. Today, it is the most performed surgery in the world. Today, much of the world is beginning to rediscover what our surgeons have refined over decades. This is our moment. Not merely to perform more surgeries, but to produce more science. Not merely to teach techniques, but to create knowledge. Not merely to follow global conversations, but to lead them. Let New Delhi become the birthplace of a new movement where surgical excellence walks hand in hand with scientific excellence, where compassion meets innovation, where affordability meets quality, where sustainability meets evidence, and where every patient contributes not only to restored vision, but also to the advancement of global ophthalmic science. Let history say that from the national capital of India arose a generation of surgeons who transformed experience into evidence, who converted colleagues into collaborators and turned dreams into reality. Let us build a chapter that future generations will inherit with pride. Let us dream boldly. Let us work tirelessly. Let us serve selflessly. Our dream is very simple and it is very straightforward. All we want is everything. Thank you so much. Jai Hind.
Yes, you have given an inspirational speech. Translate it to practice. That will be a really example to others. Looking forward to.
Thank you so much, sir. I would love to have, I have a fantastic team.
Thank you, sir. And we do have Dr. Parikshit with us. So kindly share a few words with us, sir.
Dr. Parikshit is the vice chairman of the ISMSICS. Yes, Dr. Neetu.
Yes.
Can you
So-
share the screen also? The
Yeah, we
slide.
can see it.
Yes,
Yeah,
I'm
okay.
sharing the screen.
Yeah, okay.
So probably Dr. Parikshit.
It was muted.
Sir is at the HV Desai, and he also has his own hospital called Dr. Gogate's Eye Clinic. Welcome, sir.
He is
You're
not there in
muted, sir.
HB
You're muted,
It's not
sir.
there.
He is there, sir.
All the best for your installation. And I'm sure the Delhi chapter will do even greater guns and go to greater heights under your leadership. All the best.
Thank you
Thank
so much. And to put things in perspective, Dr. Gogate happens to be the person with the largest number of meta-analysis to his name in MSICS.
So thank you, sir. And now
Anybody else from the national committee has? We can stop. Do we have Dr. Bhalla?
I think I could see Dr. Mehra there.
So we've got Dr.
So next, we have, I would like to welcome our Vice President, Dr. Balla, Dr. J.S. Balla,
Dr.
who's
Bhalla, I don't think, is Dr. Bhalla there? Well, no, Dr. Bhalla has not been able to join us till now. Maybe he'll join a little while later. Can we move on to the next?
okay. Sir. So now I welcome Dr. Anu Malik, who's a secretary of ISMSICS, and she's an assistant professor at the Cornea Cataract Refractive Services, Dr. RP Center, AIMS, and she's a gold medalist and ex-associate professor LLRM Merit, and she's the principal investigator in 2 clinical trials and co-PI in 9 trials, and managing editor of the DOS Times, associate editor in the DGO, associate editor in the UP Journal of Ophthalmology. And to her academic honors, she is a Dr. Mohanlal Gold Medal in the Retina session, and Dr. Ravikant a medal, and the gold medal in overall MBBS professional examination, and TSC scholar, and ex-member of the UP Action Plan for the Blindness Control or Diabetic Retinopathy Awareness, and worked as a senior research officer in the prevalence and rapid assessment of the blindness program strategies. We welcome you, Dr. Anu Malik, and kindly share a few words with us.
Thank you so much, Dr. Neetu. Respected seniors and colleagues, I'm really thankful for this responsibility of being the secretary of Delhi State Chapter of ISMSICS. And I hope we can take the vision of Dr. Sahu and our current president, Delhi State Chapter, Dr. Bali, with the help of all the executives. Thank you so much.
Thank you. Now next,
Thank you, Dr. Malik.
we
I
have
think-
Dr. Piyush. We have Dr. Piyush
Dr.
with us.
Piyush, can you please unmute yourself and let us see you?
I am here.
Yeah, so we can.
Good evening, everyone.
Dr. Piyush, please. Dr. Neetu, please introduce Dr. Piyush.
So, Dr. Piyush, he is a professor and HOD ophthalmology in charge of glaucoma services at LHMC and Associated Hospital, New Delhi. And to his honor, he has a Dronacharya Award by the Young Ophthalmology Society in the September 2025, FACO Glaucoma All India Ophthalmic Society 2023, and proficient FACO MICS and glaucoma surgeon, associate editor in the first South Asian edition of the Will's Eye Manual, and presented several scientific research papers, involved as a faculty speaker and instructor in various forms, and member inspection committee of NOTO, member expert committee in CDSCO, and the recipient of President Award for from Honorable Former President of India, Dr. Shankar Dayal Sharma. We welcome you, sir.
Thank you, ma'am. Respected seniors, my dear friends, I'm really happy to be part of this Delhi chapter. As we know, manual small incision cataract surgery give excellent visual outcome, almost equal to the phacoemulsification, with a lower endothelial loss. And also it is cost effective, does not require a fancy machines, and it can be performed in any kind of cataract surgery with a self-selling incision. So in developing country like ours with a high volume of cataract patients, it is very important to pass on this skill to younger generation, and we will work on it. Thank you, everyone.
Thank you, sir. Next, we have Dr. Anita. Do we have Dr. Anita with us?
Yeah, Anita is there. Anita's iPhone is.
Okay.
Dr. Bhalla has also joined.
Okay. So,
Yeah, good evening, everyone. Yeah.
good evening, sir. So, Dr. Bhalla is a senior ophthalmologist with 37 years of clinical and 28 years of teaching experience. He's an alumni of MAMC and professor and head of the Department of Ophthalmology, Noida International Institute of Medical Sciences, Greater Noida. And he's the author of 53 plus peer-reviewed publications and a booklet on glaucoma diagnostic. And he's a former secretary of DOS, currently member scientific committee AIS, DOS representative to AIS, chairman scientific committee, ISMSICS Delhi, and president-elect ACION Delhi, and recipient of numerous prestigious awards, including UC Dronacharya Award 2025, and invited faculty at major national and international conferences with 850 plus invited lectures and 1500 plus podium presentations. We have a lot to learn from you, sir. We welcome you, sir.
Thank you
Kindly
so
share.
so much. Yeah, thank you so much, Dr. Neetu, and everyone for having me on board in this prestigious organization. Yeah, there are some corrections. These are my previous assignments as member scientific committee and DOS representative to AIOS. And now the baton has been passed on to Dr. Jatinder Bali, who's the art president. He's currently member scientific committee and DOS rep to AIOS. So it'll be pleasure to work with such a dynamic and energetic team, and I look forward to a lot of academic activities where we'll try to popularize this brilliant surgery of small incision cataract surgery, which is at par with any other surgical method for cataract removal. So I look forward to be associated with this nice team with Dr. Jatinder Bali and Dr. Anu Malik and everyone on board. Thank you. Thank you for having me here.
Thank you so much, sir. We were actually looking for you. And now we can probably go on to the executive members also, please.
Yeah.
Ji, sir. So next we have Dr. Anita. She's a consultant in the Department of Ophthalmology, Sir Gangaram Hospital, New Delhi. Associate Professor G.I. Gripmer, and ex-senior resident RP Center AIMS, ex-senior research associate RP Center AIMS, and her area of specialization is pediatric ophthalmology, squint and neuro-ophthalmology, cornea and ocular surface disorders, and participated as a faculty in more than 100 conferences, published more than 50 articles in various national and international journals, lifetime member of various committees and various societies, awarded with the best free paper award in research articles, awarded with surgical skill at annual Women Ophthalmological Society conferences. We welcome you, Dr. Anita.
Thank you so much, Dr. Neetu, for this kind introduction. I would like to say thank you to the seniors here and to the whole team of this SICS society. Special thanks to Dr. Bali sir, Dr. Anu, for giving me this opportunity. And I'm really looking forward to contribute from my side to this dynamic society in a good way. And thank you so much for this opportunity.
Thank you, Dr. Anita. She's always, she's full of knowledge. She's bubbling with enthusiasm, and there's never a dull moment when she's around. Thank you so much.
Thank you, sir. Thank you so much for your kind words.
So we can go to the next executive member, Dr. Neetu.
Yes, I'm unable to see the. One second.
So again, frozen?
Yes,
I think the slides were a little heavy. Working, not working?
Not working. I'm sharing screen, but the presentation is not.
Okay, next I think is Richa. Richa is around. So if you stop sharing the screen, I will share mine.
Okay, 1 second. I'll stop. I've stopped sharing.
So you stopped sharing, and what I'm going to do is I'm going to share my screen. And where is my PowerPoint presentation? This, and we share slideshow from current slide. All right, so here we have with us. Can you see my screen, Dr. Neetu Gagneja?
Yes, I can see.
So let us introduce the AMC for the evening. It was Dr. Richa Gupta, who is the founder, director, and senior consultant at Sunitram Eye Care in New Delhi. She completed her MS in ophthalmology with a distinction and a gold medal from Mangalore Kasturba Medical College, and then went to Shankar Netralaya. She's also worked with Staff Charity Eye Hospital in New Delhi and the CL Gupta Eye Institute in Moradabad, where she pioneered one surgical technique in AGV implantation. She is currently the director of the Department of Research at the Institute. And thank you so much, Dr. Richa. Dr. Saloni is a cornea, cataract, and refractive services proponent. She's an associate professor at the PG Institute of Medical Sciences and Research in New Delhi. She is working in corneal transplant, ocular surface, refractive surgery. She is the author of more than 50 indexed publications and a speaker at national conferences. She has presented scientific talks at multiple national and international symposia. Welcome, Dr. Saloni.
Thank you, sir. Thank you for the opportunity, sir. Thank you, Bali, sir. Thank you, Dr. Neetu, and thank you, Dr. Anu, for including me. Sir, I think SICS, I think for me, SICS makes me even more confident phaco surgeon also. Because when at the back of the mind, I know I'm confident in SICS, then I do phaco also more confidently for any challenging situations. So I think everyone should learn SICS at some point.
Yeah, we're going to change the narrative quite a bit. So thank you so much, Dr. Saloni.
Thank you.
And now I'll call upon Professor Ankur Singh, who's an associate professor at the Department of Ophthalmology in the University College of Medical Sciences and GTB Hospital at Delhi. He is a vitreoretina surgeon. He is also a proficient cataract surgeon, does a lot of complicated cases. And again, he's been associated with the Delhi Ophthalmology Society. He is very active in teaching and in examinations. Welcome, Dr. Ankur. How do you feel? I'm happy to have him as part of my team.
Thank you, sir. Thank you for that such a nice introduction. I'm so glad to be part of this team under the mentorship of our seniors, you, and as well as dear friend Anu. For me, being in a teaching institute, SICS is very close to my heart because this is the first step every postgraduate should learn before moving to phaco. Because that not only allows us to work in every situation, to deal with every cataract that we see, but also to deal with problems like putting a uh, uh, iris fixated IOL, because without a tunnel, you don't know how to put an IOL, or iris fixated IOL. Secondly, sometimes you need to explant an IOL. For the same thing, you need a scleral tunnel. So SICS is the basic ground where you build upon. So if you are not proficient with SICS, you are not knowing it, you are not expert in it, there is no point going beyond it. So with this thing, I'm so glad to be part of it. And even in VR surgery, I love this part because the tunnels help me to deal with so much of complications without touching the cornea and leading to astigmatism. Thank you everyone for making me part of this.
What a fantastic perspective you've brought to the entire thing. Dr. Neetu, can you please introduce our next Executive member, Doctor.
Sure, sir. We have Dr. Shashi Srivastav with us. She's associate professor in ESI Medical College and Hospital, Faridabad, a prolific senior ophthalmic surgeon with over a decade and a half of experience in cataract and in anterior segment, and clinical expertise in medical retina, glaucoma, and oculoplasty, with various publication as a researcher and peer reviewer in few indexed national and international journals. She has presented and delivered many posters, seminars, lectures, facilitated workshops, wet labs in many national and international podium. Well connected to Pan India and global ophthalmology fraternity. She's a mother of two wonderful kids, and she has affinity towards Indian classical music and traditional dance forms. So we welcome you, Dr. Shashi Srivastav.
Thank you, ma'am. Thank you, sir. Thank you, Dr. Anu, for giving me this opportunity. Currently, I'm traveling, so there might be network issues. But I have taught my residents when I was a senior resident at UCMS and also as a consultant at ESIC Medical College. I have always emphasized the importance of learning SICS and have trained many residents in that. And I will keep continuing this and I'll keep continuing for the cause. Thank you so much for making me a part of your team.
Thank you, Dr. Shachi. That was really nice to have you here. And now it appears I have frozen my screen. So I'll stop sharing. And Dr. Neetu, you will have to share yours.
1 second, I will share. So is it visible?
Yes, it is. Oh, now this is Dr. Neetu Gagneja. I think I will take over from here.
Thank you, sir.
So Dr. Neetu she happens to be a senior consultant at the Max Super Speciality in Patparganj in New Delhi. She has trained at the Northern Railway Hospital in Connaught Place, and she is a very well-known manual small incision as well as advanced phaco surgeon, and with an interest in medical retina. She has been international faculty as well as national faculty at various national and international conferences. But the nom de plume was that she has an award from the Times Health Conclave for excellence in eye care and in cataract surgery. And that was, I think, last year, 2025, wasn't it?
Yes, sir.
Thank you so much, Dr. Neetu. She's always ready to take on challenges. And I'm really happy to have a team which is not afraid to tackle a bull by the horns. So really, really nice to have all of you on board. Can I now call upon Dr. Sahu once again for his remarks? Sahu, sir. Sir, you are muted, sir.
Okay. Is it okay?
Yes, sir. Now we can hear you. We're stopping the share, sir.
Yeah, it is a very bright team and enthusiastic and a lot of credentials. Let's hope and you make an example to others. Main thing is our focus is now research and taking the training to the grassroots level. All of you are professors and associated professors, so it is not an impossible track. It is a very easy task for all of you, and it will become an example to others. So with Bali and Anu and all of you there, I'm looking forward to a lot of action. Okay. Thank you so much.
Thank you, sir. Now I'll call upon Dr. Ankur Singh to please raise the vote of thanks.
Thank you. Thank you, sir. To begin with, I would like to thank Dr. Amulya, sir, Dr. Ravi Trahan, sir, Dr. Lalit Verma, sir, Dr. Namrata Sharma ma'am, and Dr. Parikshit sir for joining us for this momentous occasion of inauguration of Delhi chapter. Your guidance will take us to the newer height, and together with you, under you, we will love to take this Delhi chapter and International Society of Manual Small Incision Cataract Surgery to a greater height.
Can I request something?
Yes,
Yes,
sir.
sir. Sir, do you stop? We stop the share screen, na, sir?
Who is going to do the first wet lab training program? I want to hear from all of you now. Who is going to
Sir,
have the
Neetu,
first wet lab? Because
sir,
Sir, I
all of
am
you.
willing to do.
Huh?
sir, we
I
have
am willing
5
to
people
do.
here. Sir, at least 5 people we have.
So nice. So nice. That keeps us focused on all this activity because all these things will go into our website. The
And sir,
actions.
I want to point one more thing out. Sir, Dr. Piyush's mother was not well. And she's just been discharged from the ICU. And I am really thankful to him for, he said, nahi sir, main aunga. Thank you, Dr. Piyush. Thank you so much.
So
Thank you,
nice.
sir. Thank you.
Okay. So all the best to all of you. Thank you.
so much.
Anu is there or?
He is there, sir. Muted.
Yes, sir. Yes, sir. I'm there. I'm there, sir.
Yeah, it is both of you are make a good team. Lot of action we are looking forward to. Okay.
Sure, sir.
Thank you.
Thank you so much, sir.
And
Good night, sir. Good night, everyone.
Thank you. Thank you.
Thank you, everyone, for
Thank you.
making this possible. We're
Yeah,
going
all
to
the
have a
best.
great